cardiorespiratory. So these are the important keynote. So these are the concept we are going to discuss in our cardiovascular chapter. Pericardiocentesis, pacemaker, valvuloplasty, CABG, pulmonary atresia, sinus of Valsalva, truncus arterius, coagulation of aorta, endovascular repair, ECMO. This is ECMO. ECMO, ventricular assisted device, central venous catheter, and peripherally inserted catheter, PACs. So these are the topic we are going to cover in our session. So take a note. These are the important questions also. Please take note. This is a pericardiocentesis. Centesis means puncture or aspiration. Doctor, see that image. Doctor use needle to aspirate the fluid from pericardial space. So under the imaging guidance, doctor use needle to aspirate the fluid from pericardial space, to aspirate the excessive fluid. So go for 33016. So here pericardial centesis is a key term. Pericardial centesis is a key term, 33016. For drainage, what is the difference for centesis and drainage mean? Centesis means aspiration. Doctor just use needle to aspirate, to suck the fluid. In aspiration procedure, doctors use needle to aspirate the fluid. That is pericardiocentesis. So for drainage means, so doctor use catheter to drain the fluid. So because it automatically that means once the procedure, that means if a doctor remove the fluid means again it will accumulate. For example, doctor remove the fluid on morning. So again the fluid will accumulate. So in that case, doctor use catheter to drain the fluid. In that case, doctors use catheter to drain the fluid. So for drainage is the key term. So drainage procedure is performed under fluoroscopy or ultrasound guidance. For 6 year and old patient 17, birth through 5 year 18. For 6 year and old patient 17, birth through 5 year of patient age 18. Then check the difference of age 17 and 19.
CT guidance. It is under the CT guidance.
Yeah, the above code section for fluoroscopy and ultrasound guidance. Then this is a code for CT guidance. Okay. For 33019. Okay, na? Then what is the procedure? Check that. What is the procedure? Pericardialectomy. Removal of pericardium. For removal of pericardium, pericardial ectomy, go for 30. 31. So 31, 34 with the cardiopulmonary bypass. Now, doctor just remove the pericardium only. Doctor just remove the pericardium only. Did not perform the bypass surgery at the time. Doctor just remove the pericardium only, did not did not perform the bypass surgery at the time. Go for 30. Pericardialectomy with the bypass surgery means go for 30. Pericardialectomy with the bypass surgery means go for 30. Okay. Now, transmyocardial revascularization. See that these are the revascularization procedure. So that means the complication that arising in the vessels of our heart. Complication that arising in the vessels of our heart. By using of laser technique, they are treating the condition. So far, transmyocardial revascularization by thoracotomy. That means that is the open surgery. By thoracotomy, go for 141. 140. 140 transmyocardial revascularization by thoracotomy. Thoracotomy means a open surgery. Then check that what is when we apply the code of 33141. We already discussed in our last session also regarding of that.
Instead of transmyocardial, if other cardiac procedure is done, then we should use this add-on first one.
Super. During another major open heart procedure, if doctor also perform this transmyocardial revascularization means we should report this add-on code. For example, during valvuloplasty procedure, if doctors also perform the revascularization procedure means, we should report valvuloplasty is our primary DX. Then after that we should report the code for RN code 141 for transmyocardial revascularization. Okay. Did you understand guys? Now, this is a code for pacemaker. Pacemaker is nothing but like our stabilizer. It reduces the excessive impulses and it stimulates that means it also, this is one of the device to treat the cardiac arrhythmia. When a patient has a very less impulses, means it stimulates the heart. Okay, for the treatment of bradycardia and tachycardia. So this is one of the best device for cardiac arrhythmia. In that, the square-like structure is called as pulse generator. The square-like structure is called as pulse generator that contain battery. Then the wire-like structure are called as leads. Wire-like structures are also called as leads. It's also called as electrodes. So the leads that are inserted inside of our chamber. Pacemaker leads are inserted in our heart chamber, inside of our heart. Okay, take the meaning of that. Battery means pulse generator, electrode means leads. Please take a note. Chamber system means one electrode, one wire, single wire. So one electrode insert in our one chamber of our heart. That is single chamber system. One electrode that insert in our one chamber of our heart. That is single lead system. Dual lead system means two electrode that insert in our two chamber of our heart. Two electrode that insert two chamber of our heart. Multiple chamber system means 3 or 4 electrode inserted in 3 or 4 chamber of our heart. Please take a note. Single chamber, 2 electrode, 2 chamber, 3 or more electrode that insert in our 3 or 4 chamber means should consider as multiple chamber system. Epicardial electrode. So see that image. The electrode means wire, am I right? Electrodes that are inserted in our outside of our heart. For inserting of electrode in epicardial space outside of our heart. Here for open surgery. Open incision means for open surgery 202. For endoscopic surgery 203. Doctor directly make a cut on the chest and perform the procedure. For open surgery, go for 202. For percutaneous endoscopic means go for 203. So here procedures are same, but approaches differ. That's it. Now 33206 for insertion or replacement of permanent pacemaker system. Insertion or replacement of permanent pacemaker system for atrial 206. That means single chamber, am I right? For atrial 206, ventricle 207. Both atrial and ventricle means go for 208. For atrial 206, the device has inserted in our atrial, single chamber only. Ventricle 207. Okay, then 208 for both atrial and ventricle. The same code can be able to report for both initial we can apply the code for both insertion and replacement. For insertion and replacement. Now take the note. Please take a note from 206 to 208 code section for subcutaneous approach or subcutaneous technique. (206 to 208 for 206 to 208 for subcutaneous approach. Subcutaneous approach or subcutaneous technique. So now the same code. 1 minute. I will explain you later about 10 and 11. Now 216-217 is also the code for permanent pacemaker. Single chamber system 216, dual chamber system 217. Like 206 and 207. The difference means, take a note, from 206 to 208 for subcutaneous approach or technique, 216 and 217 for transvenous technique. That is the difference. Okay, did you understand, guys? I will give a corresponding practice question for you now. Now first, did you understand now? Did you understand the difference of 206 and 216?
Yes, ma'am.
Now, so 210 and 211 for temporary pacemaker. The above code section for permanent pacemaker. The above code section for permanent pacemaker. 210 for temporary pacemaker, single chamber system. 211 for temporary pacemaker, dual chamber system. So 10 and 11 for temporary. Okay. Then here, what is the meaning of pulse generator? What is another term of pulse generator?
Battery.
Now, doctor attached the battery with the previous single lead system. Existing patient already had a lead, existing lead. Lead means wire, am I right? Patient already had a wire. So now doctor attached the battery with the existing lead for single lead system 12, dual lead system 13 and multiple lead system 20. 12 for single lead system 12, dual lead system 13, multiple lead system 21. Okay. Then 216 and 217 for, we already discussed that. Same, we can apply the code for permanent pacemaker system as well as defibrillator, but transvenous technique. Transvenous technique. 218 and 220 for repair of permanent pacemaker system. Repair of the device. If a doctor just repair the device for single lead system 218, same like that. Dual lead system means 220. So what is the procedure? Doctor just repair the device. Doctors just repair the device, go for 18 and 20. Did you understand? Is there any doubt in this slide?
No, ma'am.
Now, what is the meaning of upgrade or conversion? What is the meaning of upgrade or conversion?
Another model of the same thing, upgraded version.
That means remove the older device and insert the different type of device. Am I right? So remove the old device, remove the one type of device and insert the another type of device, that is called as conversion or upgrade. Now 33214, conversion of single chamber system to dual chamber system. Now doctor remove the single chamber system and insert the dual chamber system. So remove the single chamber and insert the dual chamber. So that is conversion or upgrade. Go for 214. So repositioning means that the device has slipped. So slipping of device. So device just move from the improper location. So for that, doctor again make a surgery to relocate the device at the proper position. Slipping of device. The device has relocated on the another site, improper site. So in that case, doctors must make a surgery to relocate the device at the proper position. That is called as repositioning. So repositioning of electrode. Electrode is a key term. Now doctor just reposition the electrode 215. Skin packet. Skin packet is nothing but that is a battery. Usually skin packet usually fixed under the skin only. See the skin packet. Okay, usually the skin packet that placed under the skin packet. So here relocation of skin packet for pacemaker system 22, defibrillator system 23. Both the pacemaker and the defibrillator, both of the device are used to treat the cardiac arrhythmia. But based on the features, it will differ. Facilities, features. Based on the features, the device has differ, then code will also differ. But so relocation of skin packet for pacemaker system 22, for defibrillator system 23. Now, insertion of pacing electrode. Pacing is another type of wire. We have a different type of wire. Okay, like for your understanding purpose. Now we are using the one type of cable for to charge our mobiles, and we have a HDMI cable. So like that. So different type of cables that are present. Like here, 1 minute. Previously inserted pacemaker or defibrillator system. Patient already had a pacemaker or defibrillator system. Okay. Patient already had a pacemaker or defibrillator system. Now, doctor attached the another type of cable. The name of the cable is pacing electrode. So, now doctor attached the another type of cable along with the previously inserted pacemaker or defibrillator system, means go for 24. Okay, did you understand this code description of 24?
Ma'am, repeat it again, please.
So patient already had a pacemaker or defibrillator system. So in that pacemaker system, doctor attached the new electrode. Doctor attached the new electrode. Electrode is nothing but wire. So patient already had a pacemaker. Now the doctor attached the electrode with that. Go for 24. Did you understand, Uma?
Yes, ma'am. Thank you.
Then 25 for at the time of insertion of, see that the third line, at the time of insertion of implantable defibrillator or pulse generator. So now at the same time, doctor insert defibrillator or pacemaker along with the phasing electrode. So we should report 33208. So we should report 216, 217 or 208 or from 206 to 208. Along with, we should report this code, add and code. Because during the same time, doctor fixed the pacemaker or defibrillator system, then with as well as attach the phasing electrode, means we should report the pacemaker or defibrillator system is our primary code. Followed that, we should report the add and code. Okay? Did you understand now? Did you understand?
Yes, ma'am.
Okay. Then removal of pacemaker or pulse generator for 33. Remove just pulse generator means battery. Am I right? So doctor just remove the battery only 33. Doctor just remove the battery only 33. So remove the battery. Remove the battery. So here replace the battery. Single lead system. 27, dual lead system 28, multiple lead system 29. Okay, guys, 33 for just remove the battery only. From 27 to 29 for replace the battery. Remove the old battery and insert the new battery. Okay. Then check that what is the code description of 234. What is the code? What is the code description of 234, guys?
Removal of transvenous pacemaker.
Electrode. Yeah, electrode. The above code section for battery, then 234 and 35 for electrode. $34 for 34 for remove the electrode, 34 for single lead system, 34 dual lead system, 34. Now 36 and 37 for removal of epicardial electrode. We already discussed this in the beginning of the session. We were discussed about the epicardial electrode. Am I right? So see that these code section for inserting of epicardial electrode. Now this for removal of device, removal of epicardial electrode for single lead system 36, dual lead system 37. That's the like pacemaker. The previous slides. The previous slides are the previous slides are that explain about the pacemaker system. Now same like that, these are the code for defibrillator. So see that doctor inserting the pulsator with the previously inserted defibrillator system. With the existing, so the system is defibrillator. Attaching the electrode, attaching the S.
Background voice is disturbing.
Background disturb for 5 minutes. So sorry. So here we are attaching the pulsator battery with the existing single lead. What is the system? Defibrillator system. Then a removal of pulsator battery. So all of these code sections for defibrillator. We already discussed about the pacemaker system. Am I right? These are the code section for pacemaker system. Like these are the code section for defibrillator system. So removal of battery for defibrillator, removal and replacement of battery for defibrillator 62. Removal of battery only 41. 62 replacement of battery. 41 for removal of battery. So these are the code section for defibrillator system. Then with the 332062, 33275, with all of these code sections, supervision and interpretation is inclusive. Supervision and interpretation is inclusive. So that means should not report the 7 series code along with these 3 series code. Same like that, 76000, 77002, 76937, 93566, 75820. These code sections are inclusive with the 374 and 75. So should not report these 7 series and the 9 series code along with the 74 and 75. Did you understand now? Did you understand?
Yes, ma'am.
So, guys, please take a note. Please take a note.
Ma'am, repeat 1 second.
So, along with these three series code, 7 series codes are inclusive. So, should not report the 7 series code along with these 3 series code. Same like that with 33, 74, 274 and 75, these 4 sections are inclusive. So, inclusive means should not report the code separately. Inclusive means should not report the code separately. Did you understand?
Yes, ma'am.
Take a note. Now, try this question. Try this one. Option?
A, ma'am.
A. Check that whether it is a permanent or a temporary pacemaker.
Temporary.
Temporary.
Yeah.
So, what is the answer? A or B?
A, ma'am.
A. 33211 is temporary pacemaker system. Okay? For atrial and ventricle. Is this a dual chamber or single chamber system?
Yeah.
Dual chamber. So that's why option A is the correct answer. Super. Now try this one. Okay, others? What about others? Option B is the correct answer. Because first check that whether it is a pacemaker system or a defibrillator system. Pacemaker system. Okay. Then leads were recalled. What is the meaning of recall? Recalled means removal. Okay. Recalled means removal. So remove the leads and insert the new leads. That means remove the old leads, inserting the new leads. What is the meaning? What is the meaning, guys? Replacement. Am I right? So replacement of here, guys, 1 minute. Here we have a code 206 to 208 for. We can apply this code for inserting of new device as well as the replacement. But we can't able to apply this code because this is a what type of technique here? Transvenous technique. But 206 to 208 for subcutaneous technique.
Subcutaneous.
No subcut 2062-2008 for subcutaneous technique. But this is a transvenous technique. We do not have a separate replacement code for transvenous technique. So that's why here we are reporting the code separately for removal and insertion with the modifier 51. Did you understand? Now try this one. What is the option? What is the answer? D. Anyone, can you explain? சரி, எனக்கு சென்ட் பண்ணுங்க, நான் அனுப்பிக்கிறேன். செல்லு எங்க கிடக்குன்னு தெரியல. Dual chamber system. So that is conversion. For conversion 33214. As well as doctors also perform the procedure to relocate the skin packet. So relocation of skin packet for pacemaker system, go for 33225. 222. So 33214 for conversion. Conversion of, that means converting the single chamber system to dual chamber system. Then 33222 for relocation of skin packet. Go for 33222. Clear now? Any doubt, any question? Any doubt?
No, ma'am.
Yeah, this is a correct answer. Here, battery change. Am I right? So the old battery was removed from that single chamber system. Battery was taken out and a new battery was placed. So replacement of battery for, is this a defibrillator or pacemaker system, guys? Defibrillator. So that's why 33262. 33262 for defibrillator system. Clear? Is there any doubt, any question? Clear? Okay.
Yes.
Now valvuloplasty. So there are 4 walls that are present in our heart: tricuspid, bicuspid, aortic wall, and pulmonary wall. So tricuspid, bicuspid, aortic, and pulmonary wall. So here TAVR. R stands for replacement. I stands for insertion. R stands for replacement. I stands for insertion. So that is transcatheter aortic wall replacement. Then I means transcatheter aortic wall insertion. Okay. Now 33361 for remove the natural walls and inserting the prosthetic wall. Prosthetic wall is nothing but man-made wall. Prosthetic wall. Okay, so here inserting of prosthetic wall. Remove the natural aortic wall and inserting of our prosthetic wall. Through the femoral artery approach 61. 62. Open femoral artery. For percutaneous approach 61. 62. Open. Okay. Artery approach 61. Open femoral artery approach 62. 63. Open axillary artery approach. Axillary artery approach 63. Iliac artery approach 64. Trans aortic approach. Okay, so for trans through aorta. For trans-aortic approach 65, trans-apical exposure. Apical means that is a lower part of our heart base. For trans-apical exposure, go for 66. So these are the code section for aortic wall. And 33367 for bypass. This is an add-on code. So what is the purpose of this add-on code means? For percutaneous atrial or venous cannulation. 1 minute. I show you the image. Okay, like that. Okay, venous cannulation. Inserting of cannula in our heart. Okay, inserting of cannula in our heart. So this is an external cannulation. External cannulation in our wrist. So this is an internal cannulation. Inserting of cannula, venous cannula. Okay, venous or atrial cannula. For inserting of peripheral atrial or venous cannulation, go for 67. And 90 and 91 for aortic wall repair. Valvuloplasty means repair. Now, doctor just make a suture. Doctor just make a suture for aortic wall. In that we have open surgery. Open that indicate the open surgery. In that we have two classifications, simple and complex. So the following terms that are the key terms for simple: valvotomy, debridement, debugging. So these are the key terms for simple. And for complex, leaflet extension, leaflet resection, leaflet reconstruction. So these are the key terms for complex. So here, these are the procedure for repair. That means valvuloplasty repair. Valvuloplasty. And 4052410 for aortic wall replacement. Open surgery. Go over 3. Don't scribbling. Prosthetic wall for allograft wall 406. Stentless wall 410. Apart from that, go for 405. Replacement of aortic wall open surgery. Okay, but 460. What is the procedure of 460?
Valvectomy.
Yeah. Valvectomy. So the name of the wall?
Tricuspid wall.
So removal of tricuspid wall 60. Repair of tricuspid wall 63. So repair the mitral wall by using a catheter. Doctors use catheter to repair the mitral wall for single prosthesis. That means for inserting a single catheter 418. For additional prosthesis, go for 419. For 2 or more prosthesis. For 2 or more catheter, we should apply 419 only one time. So mitral wall repair for inserting of single catheter 418. For 2 or more catheter, we just apply 419 only one time. And 420 for valvotomy. Valvotomy means cut mitral wall. Mitral wall, closed heart surgery 20, open heart surgery 22. Surgeon make a cut incision on the mitral wall, closed heart surgery 20, open heart surgery 22. For valvoplasty, repair of mitral valve 425. Repair of mitral valve 425. Okay. Then CABG, coronary atrial bypass graft. ஆஷிக் இவங்களுக்கு மதுட்ட கால் பண்ணி உங்களுக்குலாம் எப்போ கூப்பிடுவாங்கன்னு சொல்லுவாங்க, அட்ரஸ் இதெல்லாம் கேட்குறாங்க. சொல்லுவாங்க. அப்போ அதில் செட் பண்ணிடுவாங்க. சரி, உங்களுக்கு அப்போ அட்ரஸ் என்ன வந்து அந்த இதில் ஜாயின் பண்ணிக்கோங்க. இன்னைக்கு போட்டுருவாங்க, நைட்டே போட்டுருவாங்க. ஏன்னா எல்லாரும் ரொம்ப தூரத்துலேயே வரணும் சார், அதனால் போட்டுருவாங்க. All the best. So for CABG, coronary atrial bypass graft for single. So that means bypass graft is nothing but creation of, that means doctor creating an alternative route. Doctor creating an alternative route for coronary circulation. So for example, see that here blockage is present here. So that's why doctor harvesting the artery or vein from upper extremity or lower extremity, from upper extremity or lower extremity, and create an alternative route for coronary circulation. Okay, so that is called as CABG. That is called as CABG. So in that, for coronary circulation, here if a doctor just to make a single connection according to the number of connection, we have to select the appropriate code here. So for a single connection, dual connection, so based on that, we have to separate report the appropriate code section. So CABG is nothing but creating the alternative route for coronary circulation. So see that this is a code section for vein grafting only. Vein grafting only. 335102, 33516 for venous graft only. Doctor make a venous graft only. So same like that for a single vein graft 510, for two venous graft 511. For a single connection 10, 2 graft 11, 3 12, 3 for 3 12, 4 13, 5 14, and 6 or more graft is 16. So these are the code sections for venous graft only. Venous graft only. Now I will explain you this concept later, guys. I will explain you. Now these are the code section for atrial graft only. 33532, 33548 for atrial graft only. Same like that for single graft 33, 2 graft 34, 3 graft 35, for 4 or more graft 36. So these are the code section for atrial graft. These are the code section for atrial graft. Okay. Suppose if a doctor perform both atrial and vein graft, means if a doctor perform both atrial and vein graft, means we have to, there is no add a combo code here. Okay. Suppose if a doctor perform both atrial and vein graft, venous graft, means there is no combo code. So that's why we have to report two code. So primary code should you report from 33533 to 33548, and should report the add-on code 33517 to 33523. For example, now these are the code section for atrial graft and these are the code section for vein graft. Now check that first. 3 atrial graft. What is the code for 3 atrial graft? Use my screen.
33525.
535. And along with the 2 venous graft. What is the add-on code? What is the code?
33518.
33518.
518.
Okay, we have to report 2 codes. 33535 for 3 atrial graft and 33518 for 2 venous graft. Okay, we have to report 2 codes. So take the code ranges, guys, for both atrial and venous graft. Now, procurement, that means harvesting. Procurement means harvesting. Harvesting of Stephanos vein graft is inclusive. No need to report the code for Stephanos vein harvesting. For Stephanos vein graft harvesting, no need to report the code. But if a doctor harvests the vein from upper extremity, we have to report this add-on code. We have to report 35500 with the bypass procedure. Okay, suppose femoral popliteal vein means we should report 35572 along with the bypass graft code. So for Stephanos vein graft, so for upper extremity we should report this add-on code along with the bypass procedure, and femoral-popliteal means we should report 35572. But should not apply the code for Stephanos vein graft. Please take a note this. Very, very important information.
Ma'am, can you explain once again, ma'am?
Actually, if a doctor harvests to creating the bypass, doctor will harvest the vein from upper extremity or lower extremity. Am I right? So in that case, suppose if a doctor harvesting the vein from upper extremity means we should report the saddle code. We should report 35500. So harvesting of femoral popliteal means we should report 35572 along with the grafting code. But should not report the harvesting code for Stephanos vein.
Okay.
Okay, please take a look. Now, try this question. Try this one. For what? What is the purpose of modifier 51? What is the purpose of modifier 51? I am asking about the description. Description of 51 modifier. Multiple procedure. Can we append modifier 51 with the add-on code?
No, ma'am.
No.
No, ma'am. Option C, ma'am.
So option C. Okay. Guys, please remember that should not append modifier 51 and 50 along with the add-on code. Should not append modifier 50 and 51 with the add-on code. Clear? Is there any doubt? Any doubt in this question? Then what about now? 33512 is the code of? Is the code of?
Modifier 50 is for what, ma'am?
50. You have to tell me. What is the usage of 50 modifier? What is the use? Bilateral procedure. Same procedure should be performed on both sides of our organ. That is 50. Bilateral procedure. Now, what about the use of this code 33512? If the answer is C, means why?
3 coronary venous grafts.
For 3 venous graft, 33512. Then, what about this one? 35572.
That is add-on code that femoral-led benefit.
Super. That is the add-on code for femoropopliteal vein harvesting. Super. What about that 33530?
If the surgery is performed after 1 month again, then we should.
Super. That is re-operation code, a repeated operation. So this is the second time surgery for the patient. Am I right? Because 5 months ago, patient already had a CABG surgery. So this is the second time surgery for the patient. So re-operation code 33530 is the re-operation code. Here, the duration between the initial surgery and the subsequent surgery must be 1 month, must be more than 1 month. So 33530 is a code of re-operation code. Re-operation means second time operation. So this is a second time operation for the patient. The duration between the first time surgery and the second time surgery must be more than 1 month. Then only we can apply the add-on code. Within 1 month means we should not apply the add-on code. Within 1 month, we should not apply this add-on code. Clear? Any doubt? Any doubt? Any doubt? Any question?
No.
Okay. Then see that what is the meaning of anastomosis?
Joining, ma'am.
Joining. So here anastomosis, joining of pulmonary artery to aorta, go for 606. Joining of pulmonary artery to aorta, 606. Okay. Then fistula. What is the meaning of fistula? I already explained that condition. Fistula.
Joining artery.
Opening.
Abnormal opening. Okay. Fistula means abnormal opening. So everybody take the meaning of that term fistula. Fistula means abnormal opening. Now doctor make a procedure for Valsalva fistula 702. Ventricular septal defect 710. Okay, so now doctor make a procedure to perform Valsalva fistula 702 with the ventricular septal defect 710. Then 720 for aneurysm. What is the meaning of aneurysm?
Ballooning of blood vessels.
Yeah, bulging of arteries or vein, ballooning of blood vessels. For Valsalva aneurysm, go for 720. Here we are reporting the code based on the condition. So fistula is the key term for 702. Ventricular septal defect is the key term for 710. Aneurysm is the key term for 720. Here we have to report the code based on the, here we are reporting the code based on the condition. Then see that repair of isolated partial anomalies pulmonary venous return. So if there are any abnormalities that are present in our venous mean, pulmonary venous mean, what will happen? If there are any abnormalities that are present in pulmonary vein means, what will happen?
Blood is not circulated into.
Yeah, blood again return to the lung. Am I right? because pulmonary vein only, that pulmonary vein that carry the pure blood from lung to heart. Am I right? So that's why if there are any abnormalities that are arising in pulmonary vein means the pure blood again return to the lung. So that is venous return. So for that, to repair the anomalies of the vein, go for 724. What is the meaning of stenosis?
Narrowing.
For pulmonary venous stenosis, go for 726. Repair of pulmonary venous stenosis, go for 726. 726. Okay. Then 735 for atrial septectomy or septostomy. Removal of septum or artificially make the opening of atrial septum. Same like that for closed heart surgery 735, open heart surgery. So for closed heart surgery means 735. In open heart surgery we have two classification. One is open heart surgery with the bypass procedure 36. Open heart surgery with the occlusion, inflow occlusion means go for 737. Open heart surgery. So here closed heart surgery is the key term for 735. Cardiopulmonary bypass is the key term for 736. Inflow occlusion is the key term for 737. The above core section for closed heart surgery, then the below two core section for open heart surgery. Then this is a transposition surgery. Usually aorta that carry the pure blood and that pure blood from right or left side of our heart, that carry the pure blood from right or left. Left. So here aorta that carry the pure blood from left side of our heart and that distribute for our entire body, circulate for our entire body. Am I right? So because comparing with the artery, comparing with the vein, artery that has a thickest wall. The thinnest artery is, the thinnest vessel is vein. Guys, who is, please mute yourself. Manjusha, please mute yourself. I repeatedly mute yourself. So if you have any doubt, please ask. Otherwise, everybody mute yourself because your background will disturb others. Okay, so here, comparing with that's why because this is that circulate the blood for our entire body. So that's why comparing with the vein, artery is a thickest vessel, vein is the thinnest vessel. So if there are any complications that are arising in aorta means, so at the time doctor perform the transposition surgery. So in our normal heart, pulmonary artery that carry the impure blood from right side of our heart and go for the lung. Aorta that carry the pure blood. After transposition surgery, aorta that carry the impure blood, then pulmonary artery will carry the pure blood. That means when the transposition surgery is performed, means suppose if aorta thickness is very less, if the aorta has a very less thickness means doctor will perform this surgery. Okay, for transposition of surgery 70. Okay. For transposition of 33, same code is given in that next slide also. 33770, transposition of greatest artery. Greatest means that is aorta. So transposition of greatest artery, go for 33770. Then with ventricular septal defect 70. So enlargement, septal defect is this one. This is a ventricular septal defect. Am I right? So enlargement of septal defect means go for 71. Here the term enlargement did not mention the defect, did not mention the enlargement of that. That means that is a treatment to cure the condition of ventricular septal defect. So doctor just perform the transposition surgery alone, go for 70. Along with, if a doctor also correct the problem of ventricular septal defect means go for 70. That's it. Any doubt? Any doubt? Okay. Charges. Okay. So see that this is a truncus arterius. Opening that present between pulmonary artery and aorta. Open that present between, this is one of the congenital defect. Pulmonary artery with the aorta. So for truncus arterius, repair of truncus arterius 786. Then anomalies, reimplantation. Reimplantation means this is a second time surgery for the patient to treat the anomalies of pulmonary artery. Doctor again insert the device. Doctor again insert the device for the patient to treat the condition of pulmonary anomalies. That is reimplantation. Reimplantation means that is a second time insertion for the patient. Okay. Then what is the meaning of embolism? Embolism.
Moving that
blood clot. Super. Movable blood clot. So removal of blood clot from movable blood clot from pulmonary artery, go for 910. Removal of movable blood clot from pulmonary artery, go for 910. Then same like that. During the procedure, if a doctor also perform bypass surgery, go for 10. Without bypass, 50. Embolectomy with cardiopulmonary bypass, 10. Without cardiopulmonary bypass, 90. Then 916 for endarterectomy. Now take the meaning of endarterectomy. Endarterectomy means remove the inner lining of artery. Take a note. Remove the inner lining of artery. That is called as endarterectomy. So now remove the inner lining of pulmonary artery, go for 916. So here endarterectomy is the key term. For repair of pulmonary stenosis, narrowing of pulmonary artery by patch or graft work. So here we already also discussed about pulmonary stenosis. So doctor just make a suture or doctor may insert any stent like that to treat the condition of stenosis. But in this is also the one of the procedure of pulmonary stenosis. But doctors use patch or graft. So patch or graft is the key term for 917. The 920 for atresia. What is the meaning of atresia? Atresia. Lack of normal opening. Take a note. Abnormal opening. Fistula means abnormal opening. Atresia means lack of normal opening. For pulmonary atresia, go for 33920. So pulmonary atresia is the key term. Clear? Is there any doubt, any question? Any doubt, any question? Okay. Okay guys, we'll continue on our next session. Is there any doubt with our